Meanwhile, a third American missionary is infected with Ebola. All three contracted the virus at the same hospital in Liberia. Lori Johnson tells us about this latest victim. She also sat down with one of the survivors who's now speaking out about her brush with death.
51-year-old Dr. Rick Sacra was working for SIM treating obstetrics patients, not Ebola victims, when he tested positive for the virus. SIM is headquartered in Charlotte, North Carolina. They operate Christian hospitals around the world, including the West African nation of Liberia, an area hardest hit by the Ebola outbreak. Despite that danger, Dr. Sacra put himself in harm's way after he learned his two co-workers, Dr. Kent Brantley and Nancy Wrightbull, contracted Ebola and therefore left a void in the hospital.
Rick and his family are currently living in the Boston area in the U.S. Rick travels back and forth to Liberia, and he volunteered just a month ago when Dr. Brantley and Nancy were tested positive to Ebola. Rick called and said, "I'm ready to go."
Dr. Sacra is being treated in Liberia and is said to be in good spirits and talking on the phone to his family in Boston. Right now, there are no plans to bring him back to the United States for treatment. There are also no plans to give him the experimental drug ZMapp because there is reportedly none left. However, ZMapp was given to Nancy Wrightbull, who for the first time spoke publicly since recovering from Ebola.
But the question is usually asked, what do you think saved you? Was it the ZMapp drug? Was it the supportive care? Was it the Liberian and our U.S. medical people? Was it those doctors and nurses that helped to save you? Or was it your faith? And my answer to that question is all of the above.
In a one-on-one interview, Wrightbull said while she knew the odds were against her survival, she felt the calming presence of God.
Peace that he gives in times of really difficult situations is a peace that we can't even explain. And it's a peace that just is overcoming, and it's a peace that says it's going to be okay, whether I live or whether I die.
And while she's grateful to be alive, she's grieved that back in Liberia, the Ebola outbreak is getting worse. Although Ebola can largely be prevented by keeping your hands clean, many West Africans don't know this and don't even have soap. That's where Operation Blessing comes in. By partnering with churches, they're handing out literature about the importance of hygiene. And they're providing liquid chlorine for disinfecting hands.
The real reason why it's spreading so much is people really haven't been educated enough to know about the dangers, especially in the remote parts of the country.
Operation Blessing is also donating supplies to treat Ebola patients and giving hospitals sterile equipment. So half a world away, Christians are on the ground in West Africa, risking their lives in order to save the lives of others. Lori Johnson, CBN News, Charlotte, North Carolina.